Welcome to Educate, Agitate, Organise Saturday. This programme is a collaboration between Don't Leave Organise, which fights to keep socialists in the Labour Party, and Socialist Telly. We had a brief hiatus because we wanted to line up some great guests for you. This programme is all about campaigners and campaigning. This week's episode, really delighted to be joined by Kathy Augustine, who's quite often the co-host, but it's really appropriate this week because obviously, Kathy, it's the anniversary of one of our most important institutions.
Our NHS.
So, Kathy, without further ado, we're going to go to the interview, which is with the co-chair of Keep Our NHS Public, Dr. John Pontius. Hey! Nye Bevan was the Minister for Health in Clement Attlee's post-war Labour government and was responsible for the establishment of the NHS, arguably that Labour administration's most transformative and radical achievement. The National Health Service was launched on the 5th of July 1948 with the ambition to look after people from the cradle to the grave. Bevan said no society can legitimately call itself civilised if a sick person is denied medical aid because of a lack of means. This evening, I'm very pleased to be joined by Dr. John Pontius, who is the co-chair of the campaign group Keep Our NHS Public. John, really great to see you again.
Nice to see you too, Matt.
So from Bevan, this week, obviously, we have a very different new health minister, our new health secretary, Sajid Javid. He's been described by the right-wing press as a lockdown skeptic. He is an ardent follower of Ayn Rand, and he's gone on record to say that people and businesses need certainty, and so that he wants every step of easing lockdown to be irreversible, which seems to make us a hostage to fortune. I mean, given clearly he's a very different kind of health secretary to Bevan, how worried should we be for public health and the NHS under his stewardship?
Well, unfortunately, I think we have to be extremely worried for lots of reasons, not just the ones that you mentioned. But I mean, clearly, he's an extreme free market capitalist. And his background, as you will know, is in international banking. When he was Chancellor, he did nothing to reverse the damaging cuts to the NHS, went along with austerity, and that's caused huge problems, of course, in terms of the response to the COVID pandemic. He also worked as a paid advisor for JP Morgan, after resigning as Chancellor. I think he's now given up that job. It netted him something like £150,000 a year. And JP Morgan is a huge bank that has major interests in health and digital health. And of course, digitalising health in the UK is top of NHS England's list of priorities. So in a sense, this is another instance of someone in the higher echelons of government that's running a public service, but actually has very close links with the private sector who have a particular interest in undermining that service. So that's another reason why we should be worried. But in a sense, it's more of the same. And that there was a newspaper cartoon a few days ago, and it had Matt Hancock leaving and Javid arriving, and it said, out with the old, in with the old. You know, nothing is really changing. This is a government that's not friendly towards public services, that's undermined the NHS, that is I think, bent on privatising the NHS. And instead of this being an opportunity to have a politician in charge who actually supported public services and wanted to improve the NHS as a public service, we've got someone who will continue to pursue the current market-driven policies in the NHS, and maybe even accelerate them. So it isn't going to be good for the NHS, however you look at it.
And we've seen as well, haven't we? I mean, they were desperate to try and paint the Serco test and trace as NHS test and trace. And we know that wasn't NHS, that was being, I would argue, mismanaged by Serco. And Serco have been rewarded now with a huge contract for one of the restart programs associated with Universal Credit, whereas the NHS continues to be under threat. I mean, there are lots of different ways that the NHS is being, as a public service, eroded and privatised. Could you sort of talk us through some of those?
Well, I mean, first of all, I think there's a broad definition of privatisation, but it includes the increasing involvement of non-governmental agencies, private business, but also third sector organisations as well in delivering healthcare. And the government know that privatisation is unpopular with most of the public, certainly in relation to health services. So I think privatisation is denied and then it's misrepresented. And you could see that with the Serco contact tracing test and trace setup, where it is always described as NHS test and trace, whereas actually it's a private company that's doing it. And a certain amount of NHS work has gone out to the private sector. If you look at things like hip operations, about 30% of those were being done in the private sector, paid for by the NHS, about 25% of cataract surgery. Now, is that private work or not? The government would say it isn't because the NHS pays for it. But I would say that is privatisation, because the work is being done in the private sector instead of investing in the NHS. And this comes back to the definition of privatisation. Just because you don't hand over cash or write out a cheque when you go and have treatment, if it's a private provider that the NHS is paying, that's privatisation. And when the Centre for the Health and the Public Interest looked at the Department of Health and NHS England accounts to find out how much of the budget went to the private sector, officially it's 7%, but when they looked at it, they made it 18%. And that was because some things that were private were simply not being included as monies of the private sector, such as those kinds of elective operations. Now, what we saw during the pandemic was a lot of money going to the private sector, ostensibly for them to help with COVID, although they did very little work. They had a block contract which assumed that their beds were 100% occupied and utilised, and yet they only had about 30% of their beds open. So it was a very bad deal. Now what's happened is that we've had the biggest privatisation contract ever for clinical services, which is 10 billion earmarked over the next 4 years to the private hospital sector to help the NHS catch up. And this is not where money should be going. It should be going into the NHS. There are some services where privatisation is much more marked than others. For example, in mental health, something like 44% of the budget for child and adolescent mental health care actually goes to the private sector. About a third of mental hospitals are private sector, and over 90% of the locked ward hospitals are owned and run by the private sector. So that's a sort of more striking example. So the privatisation is more prevalent, more common, and takes more of the NHS budget than is admitted. And that's a process which continues to go on. Matt Hancock famously said there'll be no privatisation on my watch. At the same time, the amount of money that was going to the private sector steadily increased. And of course, the pandemic has given an excuse for masses of contracts to be put out to private sector and other dodgy companies like those producing substandard PPE. And that kind of cronyism is likely to continue, I think, with the so-called catch-up of NHS work. It's not going to go to the NHS. The strategy seems to be throw money at the private sector, even if it's obvious that it's not working. So, the Public Accounts Committee looked at Serco Test and Trace and said they have a budget that's the same size as the annual budget of the Department of Transport. There is actually no evidence that what they've done has reduced the spread of coronavirus. What's happened? They've now been given another 350 million. Mighty also given a similar contract, extending their contract for test and trace. So even when it seemed to be failing, you still get the money. This is ideologically driven. It's not driven because of any objective measures in terms of public benefit.
And it's not just about, sadly, diverting public funds into private hands. It's also about, well, effectively kind of asset stripping, all sorts of things. There's a big issue at the moment, isn't there, around future trade deals and NHS data and what might happen with that. I know some data has already been sold to private companies. Could you talk us through some of the concerns around that, please, John?
Well, I think there's big concerns about data. I mean, data is very important because you can turn it into money, and so sometimes it's described as the new oil. And I think one of the big accountancy companies, Ernst & Young, estimated the value of NHS data at about 10 billion. And what it allows people who have access to do is to target individuals for insurance or for treatment, to be able to develop algorithms, apps for treatments and interventions, which are then sold back to the NHS. But the data on which they're based may be questionable, and it's no longer in the public domain and no one can challenge it. So those are some of the worries. And for the period of the pandemic, the government chose to give a contract to Palantir to be the single data holder of everything related to the COVID virus pandemic. Now, Palantir, people may know, is an extremely reactionary setup. It's been involved with counterinsurgency, with immigration control, with mass surveillance. It isn't the sort of organization you'd want anywhere near the NHS. And that contract was challenged by the legal team, Foxglove. And at least then there was a bit more openness about it, and also a commitment that the contract wouldn't just be allowed to run and run. But there's still a huge question about what Palantir are doing in the NHS. I think it's very undermining of trust. And if you go on the Health Service Journal website now, you see adverts from Palantir pitching to NHS trusts with their services. The more recent data concern is over the general practice data being taken and assumed consent. So rather than asking people if it's okay for their data to be taken and used, it was assumed that people would consent. And there was very little publicity about how you might opt out. Now, on the one hand, the data could be extremely useful to the NHS for research and planning. There is absolutely no question about that. But what a lot of people like me want to know is if our data is going to be taken, that it will be used for the benefit of the NHS and benefit of patients, and not for the benefit of profit-driven companies. And that should be something which is fairly simple for the government to reassure us about, but it won't do. So it won't make clear who will have access to the data, and it won't exclude the possibility of private companies being able to access that very, very personal data, which is held by GPs on everyone who's registered in their practice. So there are major, major concerns about data access and it being used by companies who might well profit from it and might actually sell it back or sell products back to the NHS. A terrible situation. Now, the government, in the face of campaigners flagging this up, have delayed the date of implementation until September. and the date whereby people can opt out was extended until the end of August. But otherwise, they don't seem to have done anything at all. So there hasn't been a rethinking about informed consent, writing to everyone, explaining what was going to happen and what the safeguards would be. So I'm not sure we're going to be in a different situation in another couple of months, unfortunately.
That opt-out, was it the 23rd of June? Am I?
It
Initially.
was, and now it's been changed, I think, to the 25th of August. But you know how many people still know about it? Not many. And people have mixed feelings about it opting out because, you know, there's a recognition that using the data for legitimate NHS-related planning and for research which will help patients is definitely a good thing. But there's also this concern about, well, you know, I need control over my data and I need to know what it's going to be used for, and then to be able to say yes or no. And Matt Hancock described consent or control of your data simply in terms of you being able to see it. That's not control at all. And this has made a lot of GPs very worried, as well as a lot of campaigners.
And how should we be concerned about? Obviously, currently we still enjoy the GDPR legislation, but that is EU legislation. They may well change that. Should we be worried about the government changing that with regards to this sort of stuff?
Yes, because the government have made it clear they don't like GDPR and they actually want to weaken the legislation around data control. So it's easier to access people's data. And this came out in a report recently, which Ian Duncan Smith was involved with. And it's clear that they want to remove some of the barriers that prevent your data being accessed and used without your consent. And this will be justified in terms of, making the whole system work more efficiently, getting rid of unnecessary bureaucracy. But actually, it will be taking away important safeguards that we've all enjoyed up to now.
Yeah, and they'll obviously use the time-old argument of cutting red tape. Well, actually, what they mean is deregulation, which usually exposes people to all sorts of risks.
Absolutely.
So, do you think there's anything this current juncture? Obviously, the Monday after this program's broadcast will be the anniversary of the NHS. This moment in time, is there anything? Do you think there's any the battle for its future? Is it really critical right now? Is there something about this point in time that's important?
Yes, I think there is, and I think it's always good to reflect on this at the time of the NHS anniversary. And one of the things that one needs to think about is the founding principles of the NHS, universalism, making sure everyone had access to high quality care, didn't have to pay. And these are really important principles that have been eroded. And we always need to ask for the NHS to be restored. There are lots of lessons that could come out of the pandemic. And I think the important lessons are that we really need to invest heavily in public services, make the NHS resilient, look after our staff, recognise the terrible stress that they've been put through. Often there's kind of moral distress about not being able to provide the right level of care for patients because of the cuts that have been made, not having enough staff, as well as the risks and dangers that they've faced. Both in health and care, with something like 1,500 deaths from COVID. But what we should have, really, we should say this is the opportunity for a public discussion and debate about what kind of health service we need and what's to be done. Now, the government are putting forward an NHS health and care bill, which purports to be a reaction or a response to important lessons from COVID, but actually isn't addressing any of these big issues. It's more about reducing accountability, making decision-making more distant from where people live, and giving more power to the Secretary of State for Health. It also looks extremely likely as if it will facilitate greater involvement of private companies in the NHS, making it easier to hand out contracts without them being scrutinized closely, and having the possibility that there will be representative of private providers, private companies on the integrated care system boards, then making decisions about how money is spent generally within the integrated care system. So that bill is due to come up any day before Parliament, may well happen before the parliamentary recess.
So clearly, Zoom is a private company. If it was a nationalised service, it would be much more effective. Unfortunately, we lost John very briefly there. So John's in a different room, and John was just explaining why the campaigners and the public need to oppose this bill.
Yeah. So just to go back over things again, the new NHS Health and Care Bill is really another top-down reorganisation of the NHS, which is going to reduce accountability, make decision-making about services further removed from local communities, increase the power of the Secretary of State for Health to intervene. It's also increasing the role of private companies. There may be, for example, representatives of private companies sitting on the integrated care system boards and then able to influence decisions about priorities and how money is spent. And there's a whole list now of something like 200 companies who are on an approved list where it will be easier for them to provide services to the NHS and at the same time, of course, siphoning off profits away from patient care. And that's always one of the big objections to the involvement of the private sector in health. So the Health and Care Bill is a huge worry. It's about to come to Parliament, and it should be rejected. It's a big distraction at the present time. You know, we've got 5 million people on waiting lists, and many of those people, probably all of them, will be much more exercised about rebuilding the NHS, getting on top of the backlog, getting them sorted out, and not some kind of bureaucratic reorganisation, which is in a sense a power grab by the Secretary of State. And the opportunity with a new Secretary of State for Health coming in is actually to say, okay, let's either abandon that completely, which would be the right thing to do, or let's at least defer it until there's been proper public debate about what it means and what the public's priorities are in relation to the kind of health service they want. Because most of us don't want to see greater private sector involvement. We don't want this fantastic 10 billion contract going to private hospitals. We want it invested in the NHS.
We were talking before this program, and you corrected me about a commonly misattributed quote from Bevan. I'm going to use it anyway because I think it's a really good quote, and I'm sure you agree. The NHS will last as long as there are folk left with the faith to fight for it. So even though he never said that, apparently, let's pretend he did. Look, how do we fight for the NHS? How do we fight back against this data grab, against increasing privatisation, against this bill?
Well, I think there's lots of ways, but I mean, actually, if you're working and you're in the NHS, you need to be in a trade union. If you're not in the NHS, you still need to be in a trade union. You should be arguing that your unions are fighting for better public services, including the NHS. You should be writing to your MP and saying you completely oppose this new reorganisation that's going to come up in the Health and Care Bill, and then join an organisation, Keep Our NHS Public. There are lots of other organisations that are engaged in the fight for a public health service, and some of them are very focused on particular issues, such as Foxglove, who's shining a bright light on the data swipe and the contract with Palantir, doing very good work there. You've got the Good Law Project that's doing excellent work in exposing the corruption in relation to contracts. So there's lots of ways that people could be involved. And of course, I would always point people towards Keep Our NHS Public, because we're a very broad-based activist campaign. We have a very good website with lots of information that people can find, including about what's happening with the integrated care systems. So I think it's very important that people educate themselves and then they get involved in whatever way they can. I mean, We Own It. It's also another very good organisation. Its brief is wider than the NHS, but they're doing good work, and we do work with them. And they're very involved with the campaign against the privatisation takeover of some GP surgeries by the American company Centene. But go to the COMP website. There's lots of information there, and get stuck in. And in the short term, I'd say also speak to your GP surgery about what they're doing about the data grab, and find out how you can opt out. You can always opt back in again if it's all sorted out as it should be, but you might want to think about opting out before the end of August.
And obviously that informed consent is really important with that. So educating yourself on these issues, going to the Keep Our NHS Public website, which is an excellent resource. If you're watching this on social media, you might be watching this on Twitter or Facebook. I always say go over to our YouTube channel, because in the description of the video there, we'll put links for all of these things. So obviously Keep Our NHS Public, but we'll put in lots of other resources as well. We'll show you how you can join a trade union, how you can write to your local representatives about these issues. Before we sign off for the evening, John, thank you so much for your time. Do you have a final message for the people watching tonight?
Well, I think last time I was on, we were talking about the People's COVID Inquiry. Now, that has had its last session a few weeks ago. It is going to have a press release Zoom meeting on the 7th of July, and the details of that will be on our website shortly, and people can watch that. And that's when some of the headlines are going to come out, where we'll be saying, look, these are the things that our inquiry has told us need implementing now in order to save lives. So these are positive things that can be done. We also, of course, still want an urgent official inquiry. And if anyone missed the sessions, they're all on YouTube. They're well worth watching, dipping into, catching up if you missed anything. But I'm afraid what they've exposed is that this government's general handling of the pandemic has been absolutely dreadful, and there is no sign of that changing. So their strategy is still throwing money at the private sector, hoping that vaccination is going to get us out of the problem, and ignoring the basic public health things like an effective test and trace system based locally, like making sure that people are supported. So if they're asked to isolate, they can do. And I think the current situation with the new health secretary talking about relaxing restrictions, getting the economy going, it sounds like they're going to accept having COVID going on as part of a normal part of life. And there will be people who die as a consequence of that. And the public will be blamed for not following the rules or not getting themselves vaccinated or whatever. So there still needs to be an urgent rethink of the government's public health strategy for eliminating COVID. And it's only when that's been done that I think there's a chance for the economy to recover. And if they'd done this right at the beginning, as we've seen in other countries like New Zealand, there would have been much less damage to the economy and a much faster recovery.
John, thank you so much, as always. Yeah, thank you. Sorry, I'll do that again. John, thank you so much, as always. That was a really interesting discussion. It would be great to have you back on and some of your colleagues from the People's COVID Inquiry to talk about those findings. I think that's really, really important that people understand and know about that. But thank you so much for your time.
Okay, you're welcome. Thanks very much, Matt. All the best.
So, Kathy, it was really great to have John back on the show. I mean, he was great on the People's COVID inquiry episode. And I think, obviously, from that interview, I think we're going to have to revisit that, especially as we've got some key findings from that coming out. Obviously, I know you're very closely involved with Keep Our NHS Public, but there is, of course, another organisation that's a really important part of socialism and the health service. Do you want to tell us a bit about that?
Sure. So John encouraged people to join Keep Our NHS Public, which I absolutely support, of course. But there is also the Socialist Health Association. So that has much closer links to the Labour Party. It is one of the affiliated socialist societies, and very recently has demonstrated our mantra, if you like, of don't leave, organise. So don't leave the Labour Party, organise within any of the structures that are open to you. And huge congratulations, rather belatedly, to the new leadership of the Socialist Health Association and the new clean sweep Central Council of socialist members now running that organisation for us. So there's a great example of staying in the party, organising and fighting for our socialist values and policies.
And of course, there's the women's slate as well. We should talk about that.
Absolutely. So there are 6 CLP places on the new or renewed National Women's Committee. There were 6 socialist candidates who got into all those 6 places by huge margins. There are some other socialist women that we know of who are on that committee now through being union reps elected, and also the devolved countries, Scotland and Wales. But it will be a little bit like the NEC. Yes, we did really well with the 6 CLP seats, but the committee is much bigger than that. So those socialist sisters will have some challenges on their hands, and will rely on each other and on our support as well through local women's branches, the motions we pass to really strengthen their voices on our behalf.
And it just goes to show, doesn't it, when socialists organise, when they stand together, we win. And one of our most important wins was winning that right to universal healthcare in that transformative government of 1945. And really that right, that universalism, it's been under attack ever since, hasn't it?
Yes, it has, for sure. I mean, John covered so many of the aspects of privatisation. He said more politely than I'm going to, that when the Tories are challenged on this, they actually lie about the amount of privatisation going on in our NHS. And you highlighted the, really relevant topical example of Serco test and trace, when actually campaigners had been saying, no, fund us locally and we can make this a far more effective process. And that is still under debate. That hasn't been addressed. Also, John was talking about the government white paper. It's going to become, or it will be proposed as the NHS Health and Care Bill. And some people are welcoming this because it overturns the 2012 Lansley bill, which really, pushed us up a gear towards privatisation. But there are things in this bill that are also as worrying as John explained to us. So this is another hashtag kill the bill, in its entirety. Well-intentioned amendments, of course, we have to try to chip away. But in fact, integrated care service is going to open the door, which is, ajar, then open, then wide open to privatisation, which makes absolutely no economic sense. It is an ideological choice, just as austerity in general has been an ideological choice, just as the shocking migrant charges within our NHS NHS are an ideological choice. The cost of collecting and following up and hounding people to pay those migrant charges really doesn't cover the cost of the services. So it is part of the hostile environment, really.
It's purely punitive. And
Absolutely.
I think it's really important. We should talk as well about that, just the importance of what we're talking about here is the principle of universalism under attack from the opposite and opposing principle of greed, of individualism, of selfishness. And that's fundamentally what the Tories are about, isn't it? And it wasn't just, of course, the NHS that Attlee government built, but also massive increase in council houses, the universal right to a decent home. And we've gone so far backward in so many areas of our society on this stuff. I think it's also worth pointing out, there's a really excellent piece in the Tribune about our new health secretary. And I didn't know until I read it. One of his junior ministers is actually from Serco. So they're completely wedded to this advance of the private sector. Yeah. And we've seen how important in this crisis, in this COVID pandemic, how essential universalism is, universal access to rights and services. I mean, that manifesto that we had in 2019, they laughed at what they called broadband communism. How important would that have been? How transformative would that have been over this last year? There's so much isolation, just the impacts on people's mental health, and that didn't have to happen. So I think you're absolutely right to point out that what the Tories are pushing for, they always paint it as pragmatism. It's not pragmatism. It's short-termist. It's ideological.
And it is cruel. And they don't care about that. I mean, I've talked before on this programme, I think in relation to the NHS, actually, it might have been the last programme we did with John Pontius. And it just springs to mind every day for me, Engels' description of social murder, whereby the elite, the powerful, put us in a position where our lives are shortened unnaturally by their legislation, by their actions, by their greed, selfishness, and cruelty. And we can see that even though Cummings, thank God, is gone, his eugenics agenda and herd immunity haven't disappeared, because look at the muddle we're in again with lockdown or not.
Horrifyingly, we're seeing that in schools now, aren't we?
Yes. And look at what our new health secretary espouses. So, join KONP, join the Socialist Health Association. And I hope many, many of us were out on the streets today campaigning on the 73rd birthday of the NHS, not only against privatisation, but another key part of this is the way that NHS staff are treated. Clapping in the streets for them and offering derisory pay. Join a union, stand up for your rights, everyone. But of course, NHS staff really need that support from a union and from us, from their communities, from patients. Patients' voices are really important in this.
Absolutely, really important points. And we must stress and echo everything John said as well. Go on Keep Our NHS public website. There's some great resources there. Especially check out the People's COVID Inquiry stuff. It's really it's harrowing, but it's important that you understand what's been going on within our NHS and how it's been so mismanaged by this government.
This new bill and the ICSs are quite complicated. And it's very, very difficult to explain to people what this will mean in terms of their treatment and the ongoing increase to our waiting lists, which are currently around 5 million patients on waiting lists. So KONP has created some very easy to understand resources and materials. So please, when you're on the KONP site, as I hope people will be, to join and to look up all sorts of information. you'll also look and understand what this new bill is actually seeking to do. The devastation through privatisation of our NHS is hugely accelerating, and this will put it into fifth gear. One of the things that is so important, to your point, Matt, on universalism, we must remember that campaigners require effectively a renationalisation of our NHS. So publicly funded, but also publicly owned, publicly run, and then free at the point of need for anyone who requires healthcare. So it's that complete package. So when the Tories try and distract us by saying, oh, well, of course it's publicly funded, that is only one piece of what we need to get back to 1948 and the birth of our NHS. It has to be publicly owned, publicly run, and free to all who need it.
Absolutely, couldn't agree more. So join a union, support, keep our NHS public, think about joining the Socialist Health Association, fight for the NHS. I mean, I know that we did say that that famous Bevan quote is a misattribution. Apparently, it's from a TV show, but I still think it's worth repeating. The NHS will last as long as there are those folk who have the faith to fight for it. And most importantly, do not go gentle into that good night. Watch Educate, Agitate, Organise every Saturday night. Kathy, thanks for joining me.
Thank you, Matt. Solidarity.